So we're talking about improving your smile. And the first thing you need to know is that your mouth is a microbiome. So you have good bacteria and you have bad bacteria. So you need to help your good bacteria and starve off and kill the bad bacteria. Most dental decay is due to one type of bacteria. Streptococcus mutans is responsible for most dental decay. It kind of collects on your teeth as plaque, and then it attracts other bacteria that kind of eat away at your teeth and cause all sorts of problems. Dental decay is linked to heart disease and other illnesses because when you have all those things going on with inflammation and bloody gums, that's actually an infection that you need to kill and get rid of. And it is totally possible to do that by just eating the foods that are good for your teeth and kind of starving out the bad bacteria. And I know you can do this because I did this in my 20s without even knowing it. All I did was eat well, not eat like the sugary, starchy foods that you know aren't good for you. And I chewed a lot of sugar-free gum, which has xylitol in it, which helps starve out that type of bacteria. And I didn't need dental cleaning for years because I got rid of that bacteria. There was nothing on my teeth for those dental hygienists to clean. So anyone can do it. If I can do it without even knowing it, anyone can do it. Another good thing to do to protect your teeth is to drink water often to keep your mouth moist, or to chew sugar-free gum with xylitol in it to produce more saliva to help the good bacteria in your mouth. So just keeping your mouth hydrated, moist, have a good environment for the good bacteria to thrive in. One of the first things you also need is a good dentist that is honest, trustworthy, knowledgeable, up to date on the latest technologies. Like they should be using 3D scans and making appointments easier for you. They should make it easy for you to book appointments, reschedule appointments, and cancel appointments. You're having problems with your dentist and they're not addressing it. If you have addressed your problems and discussed them with your dental office and they're kind of ignoring your problems, feel free to leave an honest review, because a good dentist will not tolerate having bad or negative reviews out there on them. They're going to want all good reviews. And that's what you should be looking for when you look for a new dentist. Make sure that they have good reviews, have references. Like when I found a good dentist, I referred my whole family to that dentist. So we brought in a ton of new business for him. And when I had a problem with my previous dentist, I had one of the worst dental experiences of my life with someone that was not trained well. They were not on top of things when I went into the office. They didn't have my insurance or my records. It was just a really bad first impression. So I never went back there again. And neither did anyone in my family. We all went to this good dentist. So find a good dentist because they will save you so much money in the long run. They won't recommend treatments that aren't in your best interest. Like my dentist would not recommend veneers because you're filing down nice, healthy teeth to get a veneer. And it's not worth it. You can prevent a lot of problems by just not doing procedures that aren't in your best interest. He also said to not get invisible liners because they wouldn't work for me because I have a little bit of an open bite, and invisible liners don't usually help with that. You need the braces, which I had and had fixed it years ago. But he said that because the problem's really with my tongue pushing the teeth forward, that it would just happen again, even if it did fix the problem. That my tongue is such a strong muscle that it would push the teeth back where they were. So a good dentist will not recommend treatments that won't work for you and save you so much money just doing that and preventing other problems like dental decay and all sorts of problems that could happen with your teeth. And you need to do your part by brushing every day, twice a day. Flossing, I really like this one because I'll use this between brushing as well. And you need to floss as well. I really like these flossers because this one has like two threads on it. And if you want to even go even further with your flossing, you could put a little bit of toothpaste on that floss and get right in there. So it's like you're really brushing in between your teeth. So do your part by taking care of your teeth and having good dental hygiene and getting that bacteria off before it starts to build up and turn into plaque and cause other problems. So whatever toothbrush you're using, I mean, I like sonic toothbrushes because they really get a lot off. But whatever toothbrush you're using, you need to change the brushes regularly as well. This one actually has an indicator, and a lot of them do. But do your part and make sure you're up to date on all your cleaning, taking care of your teeth to prevent any problems. And also, there's a lot of new products coming out. I just bought this one here because it has this in it. It has HAP in it, which actually can help rebuild your teeth, remineralize your teeth. This one also has baking soda, which is also really good to get rid of surface plaque and kind of polish your teeth without damaging your teeth. It doesn't polish it too much. It's actually really safe for your enamel, unlike charcoal toothpaste, which you should not be using because it takes away too much. So if you have charcoal toothpaste, get rid of it. It's not for you. It's actually really good for cleaning the headlights in your car. So that's what I use mine for. But anyway, this one also has xylitol in it. So it has a lot of things in it that are good for your enamel. And it also help with getting rid of that bacteria that I was talking about, the Streptococcus mutans. This will help create an environment where that bacteria can't grow because the xylitol really helps starve it out. And so there's a lot more of these types of products with the HAP in it coming out. Ideally, you want to get a nano product that is actually going to get into the crevices and cracks in your teeth. That will really help mineralize it. But this is kind of what I found for a good price. So I recommend using it because I've only been using this for a few days and I already feel a difference. Like my teeth feel like dentist clean. I don't feel any plaque on my teeth, and there was maybe a little bit there before, but this actually got rid of it. So it's working really well, and it's not really any harder than brushing your teeth. One thing you should also never do is to use alcohol-based mouthwashes, because those get rid of the good bacteria and the bad bacteria. So it's kind of really just a wash. So you're giving a chance that the bad bacteria will kind of take over the good bacteria, and because you're washing just everything out. So just, if you have it, don't use it. It's not good for your mouth. It's drying things out. Get rid of it. Not for you. I always like toothpaste with baking soda in it for polishing, but this one also has peroxide in it. So if you're looking to whiten your teeth, peroxide is really good. So get a toothpaste with peroxide. There are also lots of other products that you can use for whitening, and they're not expensive. You do not need to get a whitening at a dental office. You can get it really anywhere. These three are all from the dollar store. So these ones all have hydrogen peroxide in it, which is effective for cleaning your teeth. These ones don't give you the percentage, so they're probably not that strong, but they will work. I mean, they have the pens here, which I really like the pens. They have the strips here that these cost a lot more online or by other sellers, but this is from the dollar store, so it's super cheap. And then this one is just another brand of a whitening pen. What I got was this one on Amazon, and I got this because it has carbamide peroxide. So this is one of the strongest you can get at 35%, and this will whiten your teeth really well. And this wasn't expensive either, because I think this was about $14 for 4 of them. So what I like about these and using the pens here is that you can kind of just put it on the teeth where you want it and not get it on your gums, because it can make your gums more sensitive. So something like this, you're just putting it exactly where you want it. It does a good job of kind of even getting between the teeth, more so than the strips, where they can kind of make your gums more sensitive. If they're on your gums, you're kind of wrapping it around your tooth, so you're getting the backside as well too. So I would recommend the pens over strips. And they also have like a gel that you can put in. So if you have like trays for your teeth, you could use a gel, but these are messy and can make your gums sensitive too. So ideally use a pen. These work great. I have never gotten a professional whitening before because these work really well. Another tip is to wear a retainer. This can help prevent a lot of damage to your teeth, especially at night when you're grinding. So it also helps you keep your mouth closed so you're breathing through your nose instead of your mouth. But you can see, I've only been using this for a week or so, and you can see the impressions that I've made that would have been transferred to my teeth, damaging my teeth from grinding at night. I even ripped it with all the pressure I was putting on it. So this is well worth it. This only cost like $2 on AliExpress, and I ended up getting like a box of 5 of them for $8. So it's a good deal. Plus you can wear this during sports or anything you might have a hit to the teeth that would cause more damage. And these, I like these because they're flexible and they're comfortable at night. With them only costing $2, I don't feel bad about like cutting them where you need them to kind of mold around your gums or your teeth. This one has a little tab on the top here. This is for like tongue positioning. So you train your mouth to put your tongue in the right position at the top of the roof of your mouth. And you know, for $2, I give these all to my kids. And my oldest daughter doesn't need braces because of these retainers. They actually help straighten your teeth. So she wears these at night. And before, she was getting recommended to go to the orthodontist for an evaluation. But after wearing these for a few years, they assume she had braces because her teeth are so straight. So well worth it for a lot of reasons, you know, to prevent damage and to help straighten your teeth and help you breathe through your nose at night. Here's a bonus section. So some of you eagle-eyed viewers might have noticed that I am missing some teeth. These teeth here are canines, not incisors. I'm missing the incisors. So what they did was move all my teeth forward to fill in that space, and I got to keep my wisdom teeth on the top. I'm actually missing my bottom wisdom teeth as well. It's actually one of the most common teeth to be missing is wisdom teeth. So, and the second most common teeth to be missing is your two incisors here. So this is fairly normal. It's actually like a evolutionary trait going on because your mouths aren't as big as they used to be. We don't do as much chewing as we used to, so our mouths have become smaller, and we don't need those teeth anymore. Usually you have to get your wisdom teeth extracted because you don't have room for them because our jaws aren't as big as they used to be. I'm also missing a random premolar. So this tooth right here, this small one, is actually an implant. And if any dentists are watching, hopefully the dentist, but if any dentist can answer a few questions I have about this, because this dental implant was done years ago. So I don't have the records on this anymore. And I've been told that I can't replace it without those dental records because they don't know what's in there and what they'd be putting a crown on. But I was wondering if there's anything else you could do. Like I have been hearing about 3D printed veneers, and I don't know if there's anything you can do to put over a crown that would make it look like it's not a baby tooth, because when they did this years ago, they made it super small. It looks like the baby tooth I had to get extracted, which is another good point. Never have a tooth removed if you don't absolutely need to have a tooth removed. Just save yourself some money. If you do not have to have a tooth removed, don't. Because I feel like I should have just kept that baby tooth in there. It would have saved me a lot of money. And I don't know how long I would have kept it, but some people keep their baby teeth their whole life. So I shouldn't have pulled or had that tooth pulled. They did it before I had braces to make room for this implant. But anyway, one of the questions I had about another question I had about this is, do dental implants cause like bony formations? Because in my gums here, you can kind of see that there is like bony overgrowth. And I know it's bony overgrowth. It's not any type of infection or anything. It's been x-rayed. It's just bony growth there that's in excess to what I have in other places. So I was just wondering if anyone knows if getting a dental implant can cause more bone formation in the site of the implant. I don't know. I've asked my dentist and they just say it's normal growth, but they didn't really say anything about it being related to the dental implant, but I feel like it could be. So let me know. Also, if you have any other questions about dental care, improving your smile, besides that one tooth there, these are all my natural teeth with no bonding, no crowns, no professional whitening, just over-the-counter stuff. Let me know if you have any questions. Please comment on this. Please answer my questions. Like, can I do anything with this implant? And is it causing bony overgrowth? I don't know. So let me know. Thank you for watching.